A lot of times people will ask me, is it okay if I drink on my antidepressant? And my response is usually, there's nothing dangerous about it. But what you have to remember is that the alcohol as a depressant is going to be fighting against the benefit that we're looking for from the antidepressant. In other words, it kind of muddies the picture a little bit because excessive alcohol use in and of itself can cause a syndrome of depression. Now, about half of people who drink too much alcohol have depression as well. And a large number of those, it's really all alcohol related. They may not have an independent clinical depression. So that's my usual response is like, well, it's you're not going to blow up, there's no dangerous interaction, but you're really sort of going at cross purposes. Now, having said that, if you present with a severe depression and you're drinking too much, we're still going to treat the depression. And we really make a decision, how severe is the depression? Is it including suicidal thoughts, even a passive wish to die, or more active suicidal plans or methods or intention? Then we really are incumbent to treat both at the same time. And then you can often tell if someone has independent depression by asking them about how they felt during extended periods of sobriety, or did they have depression before they started drinking? So people who start drinking when they're 18, do they have a history of depression in adolescence or childhood? So we have some indirect ways of figuring out if someone has depression independent of alcohol. And in that case, we'll treat it independently. And obviously, if it's very severe and we don't know if it's just alcohol or not, we will still treat it. But to treat depression, reducing your drinking treats depression. I used to think it's all or nothing. Back in the day, when I trained, it was sort of like any amount of alcohol causes depression. And what I really think is, and this makes more sense, is that the more you drink, the more prone to depression you are. Now, having said what I just said, there's a subgroup of people who take antidepressants who tell me that they feel sensitized to alcohol and they don't want to, the SSRI in and of itself makes them feel like it's naltrexone. And I can't really explain that, but I have some people say with both the SSRIs and also Wellbutrin, bupropion, that they feel like their tolerance is way down, but they feel really intoxicated after 2 drinks when in fact they usually drink 6 or 7. And I don't know the explanation for that. But there's nothing dangerous about drinking while you're on antidepressants. It's just at cross purposes.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.